How accurate are STI blood tests? Imagine you're worried about an infection and want to get tested. Blood tests for sexually transmitted infections are a common way to find out if you're infected. They are generally very accurate when done correctly and at the right time after exposure. But their accuracy can depend on the specific infection, the type of test used, and how soon after exposure you get tested. Blood tests can detect infections like HIV, syphilis, hepatitis B and C, and herpes simplex virus. These tests work by looking for antibodies or antigens in your blood. Antibodies are proteins your body makes to fight infections, while antigens are parts of the virus or bacteria itself. Many blood tests for STIs have accuracy rates between 95 and 99%, making them reliable tools for screening and diagnosis when used properly. However, several factors influence how accurate these tests are. One major factor is timing. After exposure to an infection, your body needs time to produce enough antibodies or antigens to be detectable. This period is called the window period. Testing too early during this window can lead to false negative results, meaning the test says you're not infected when you actually are. For example, HIV antibody tests may not detect infection if done within 3 weeks to 3 months after exposure, depending on the test. The type of infection also matters. HIV blood tests, especially modern combination tests that look for both antibodies and antigens, are highly sensitive and specific. But for herpes, blood tests can sometimes produce false positives or negatives because the immune response varies and the virus can remain dormant. Confirmatory testing is often recommended if initial results are positive, especially for infections like syphilis or herpes. The method and validation of the test are important too. Tests like nucleic acid amplification tests, which detect the genetic material of the virus, are extremely sensitive and specific. Although these are more commonly used on urine or swabs, some blood-based tests for certain infections are also very accurate. Proper sample collection and handling are crucial to avoid errors that could affect results. Sometimes, a single blood test isn't enough. Confirmatory tests are used to verify initial results, especially if the test is positive. For example, a positive syphilis test is usually followed by additional testing to confirm the diagnosis. In some cases, other testing methods like swabs or lesion samples may be more reliable for certain infections like herpes. In summary, blood tests for STIs are a vital part of sexual health screening and are highly accurate when used correctly. But no test is perfect. Understanding the window period, the specific infection, and the need for confirmatory testing helps ensure you get the right diagnosis. Regular testing and talking openly with healthcare professionals are the best ways to stay informed and healthy. Remember, if you have concerns or questions, always consult a healthcare provider for personalized advice.